We will now share with you the best Enluxtra application practices from professionals in the field. Proper sizing is critical for best results. Larger dressing equals better outcomes. Think of Enluxtra as a container. The larger it is, the more exudate is absorbed away from the wound. The more exudate is absorbed, the more harmful bacteria and fluids are locked away from the wound. The more bacteria and fluids are evacuated, the faster the wound is cleared. The cleaner the wound, the fewer dressing changes you will need. Fewer dressing changes mean longer time between changes, and medical professionals know that the less you disturb the wound, the faster and more efficiently it will heal due to uninterrupted homeostasis. When the wound is large or has an irregular shape, tape 2 or more dressings together to achieve full coverage of peri-wound areas and to overlap healthy skin by at least 1 inch. When covering a large area with several dressings taped together, cut off the dressing sides to straighten the dressing edges and to ensure there are no gaps where their corners meet. Trim Enluxtra only if its edges interfere with body part movement or around appliances that require a specific fit. Enluxtra is perfect for heel and toe wounds. Simply cut slits in the sides of the dressing and form a cup to cover a heel wound. Use a similar technique for toe wounds. When using Enluxtra for edema and under compression, first, using scissors, form a bevel of up to ½ inch wide around the entire dressing edge on the wound contact side, and place the dressing on the wound. This will help prevent dressing edge from indenting into the surrounding tissue. Then, bolster cotton batting around the dressing perimeter and level out the transition from the dressing edge to the skin. This will further reduce and redistribute the compression bandage pressure on the dressing edge. Apply compression bandage. This bevel and bolster technique will help protect the delicate skin from dressing edge indentation and give the dressing room for swelling when it absorbs exudate. When applying Enluxtra alone, when you only have 2 hands to work with, use this simple technique to make the process fast and easy. First, prepare 2 small pieces of tape. Then, temporarily secure opposite corners of the dressing to hold it in place and prevent it from sliding off. Then, use longer pieces of tape to secure all edges. Securing Enluxtra for dry wounds, incontinence, and showering is fast and easy. Use a moisture-resistant adhesive tape along the dressing edges. Do not use paper or cotton-based tape. Alternatively, you can use a transparent film dressing such as Tegaderm, Opsite, or similar. The film must completely cover Enluxtra and extend beyond the edges for at least 1 inch. Note: if the wound is dry, before applying Enluxtra, moisten it with saline or distilled water. Or apply amorphous hydrogel to the wound bed area and exposed tendon and bone. No need to pat dry. Although it is very rare, a few patients have reported irritation occurring while wearing Enluxtra. Do not automatically assume this is an allergic reaction. Remember, Enluxtra is a hypoallergenic product. If irritation occurs, simply go through the following steps. First, check if the dressing is large enough. If the dressing is too small, the drainage could begin seeping out of the dressing edges onto healthy peri-wound tissue. This can cause pain and discomfort, and the peri-wound tissue could begin showing signs of irritation, often mistaken for allergic reaction. Ask your patient at what time pain or discomfort occurred. Take the time of day and the day of wear into account. Reports about discomfort occurring around 2 to 6 a.m. might be due to ischemic pain. Reports around the fourth day of wear might be simply due to leakage from an overfilled dressing, and it might be time to change it. It is important to avoid products on our non-recommended list. These products may cause clogging of Enluxtra and impede the vertical draw of the material, preventing exudate from being absorbed into the dressing and spilling onto healthy skin. Note: patients' personal allergies to any product used in conjunction with Enluxtra could be amplified due to the moist environment created by the dressing. Please note that a true allergic reaction occurs within 3 hours after application. If a patient has an allergic reaction to dressing polymer materials, discontinue dressing use. Anything after 3 hours past application is likely to be skin irritation caused by exudate and must be addressed as such. Frequently, placement of a non-adhering wound contact layer known to be tolerated by the patient under Enluxtra resolves the problem, and Enluxtra use can be continued. Changing Enluxtra is fast, easy, and painless. Remember to always change Enluxtra before the exudate reaches the dressing edge. Otherwise, the exudate could start seeping onto the healthy peri-wound skin. In case the patient is experiencing more discomfort than usual, you might need to adjust placement, size, or dressing change frequency. Please remember that regular Enluxtra wear is comfortable and painless. As we know, Enluxtra is designed to stay on a wound for up to 7 to 10 days. However, when you first start using the dressing, it is best to increase wear time gradually to clear the wound from any non-vital tissues, such as slough, necrosis, etc. For copiously draining wounds, initially change every day until the drainage subsides. This usually takes about 2 weeks. For all other wounds, change every 2 to 3 days until the wound is 80% cleared from slough. This usually takes about 2 weeks as well. To optimize Enluxtra placement for best results and longer wear, study the drainage patterns upon removal. Factors such as body positioning and gravity may cause the exudate to flow in one direction more than others. Place the dressing to accommodate the excess exudate flow. Now, let's look at recommended co-products that work exceptionally well with Enluxtra. If adhesive tape is needed, use Mebitac, Mefix, waterproof medical tape, or any other tape you prefer. Enluxtra works wonderfully under compression wraps, Uniboots, conforming gauze wrap, Tubigrip, lymphedema wraps, and all compression pumps. When transparent films are required for dry wounds, incontinence, and showering, use Tegaderm or Opsite. Packing materials we recommend are AMD gauze moistened with saline, antimicrobial PHMB impregnated, moist gauze with silver hydrogel base, or any hydrogel saline impregnated non-shrinking product. RTD foam strips by Kenrick Healthcare, Yodaform strips, Yodafoam, Hydrofera blue strips. Recommended antimicrobials are Silvasorb, Silvercept, Anacept. Contact layers, Mebitel soft silicone, and Adaptic Touch without petroleum. It is important to note that some products are best avoided when using Enluxtra, such as all alginates, all cellulose products, all honey products, thick and viscous pastes and ointments, skin preps, all petrolatum-based products, moisture barriers.